when those sort of common coping mechanisms aren't working, at what point, I guess, should someone consider seeking professional help?
So I think, if those struggles like a low mood or anxiety go on for quite a period of time and it is getting in the way of day-to-day life, then it is time to think about asking for help and support. So for adults, a really important person to start with would be your family doctor. Also your kidney care clinic team. Those are all really good sources of information and resource, and those members of your team can certainly direct you to other resources that exist in your area that can help with mental health. Some people can access counseling through their employee assistance program, so that can be something really helpful for adults to look into. And then when it comes to crisis services, it's also really important to know that those exist 24/7. So, in your local area, there will be crisis services and crisis lines that can click in if someone really needs in-the-moment support. So for children, again, family doctors are a great source of information, or a pediatrician, and that's a really great starting place.
So Dr. Moon, can you talk a little bit about your role here at BC Children's?
Sure, yes. So I have the opportunity here at BC Children's to work with the renal team as well as the multi-organ transplant team. And so these teams care for babies all the way up through young adults, age 19, in our province, who have kidney disease, who are on dialysis, and then who have had an organ transplant, including a kidney transplant. And so I'm part of a big interdisciplinary teams. Those include physicians, nurses, social workers, dietitians, physiotherapists. There's a really big team, lots of different disciplines around the table who provide that sort of wraparound view of the child's health. And so luckily, in each of those teams, there really is a big focus not just on how the child is doing medically, but what is their quality of life. So, how are they doing at school? How are they doing in terms of their emotional well-being? How are they doing in terms of their relationships? And how is the family doing? And that makes sense because we know that all of those things really impact how the child is doing medically as well. So when you address things like mental health concerns in young people with chronic kidney disease, their medical outcomes improve as well. We know that for both children and for adults. And so I'm really lucky to work in this team, in these teams where there really is that holistic focus. So, how is the child doing in terms of all of those aspects of their life? And that the goal is not just treatment of the medical symptoms, but getting them back to more, as full and fulfilling of a life as they can have.